Our next speaker is a guy who's really one of my favorite people in the country, Mike Tetrault, editor-in-chief of Concierge Medicine Today. Mike is a respected voice and a pioneer in communication and a community builder in direct primary care. He's published, everybody reads his journal. I'm sure you all have read it. He's one of the world's leading concierge medicine spokespersons. He's probably accumulated more data and information on what we do than anybody else in the country and published it and written about it. I've enjoyed reading his columns and publications for several years now. He's a moving force. He's marketing and business development efforts have included Consumer Report, Smart Money Magazine, NPR, CNBC, CNN, Heritage Foundation, Wall Street Journal. He's written extensively for lots and lots of organizations, and I'm sure he's going to give us a great talk. Update on concierge direct practice from Mike Tetrault.
Great, thanks. If any of y'all remember that CNBC moderator, she actually was the one that was very generous and very good and positive towards concierge medicine, which from a liberal media perspective, that is amazing. And so I'm actually here today. I want you to, I'm going to go through a lot of things fairly fast, anticipating that I would be going through things very fast. I want you to feel like this by the time you go to lunch, all right? This will be very quick. 12:30, okay, so I've got 35 minutes. If you have questions, because I want to get through as much information as I possibly can, I've got some new information. But this is actually there's a quote that is sitting in one of my mentor's offices, and it's on his wall, and it says, let me make sure I get it accurate. If you got kicked out of your business or out of your practice, and the board brought in a new CEO or a new doctor, what would he do? And here's the catch. Why shouldn't we walk out the door, go to lunch, and come back and do it ourselves? So if you got kicked out of your practice, and they hired a new doctor, and you just said, oh man, what is that guy going to do? And then why not instead leave the room, go to lunch, come back and rehire yourself and think and do the things that you want to do? So many times I've seen in so many offices, we spend a lot of time coaching a lot of physicians as to whether or not they should do this or shouldn't do this. And we're simply an educational arm. That's our place in the marketplace. We want to connect them and walk them across this foggy bridge and connect them with people who have greater intelligence than we do, people like yourselves in this room who can essentially answer those difficult questions for them about whether or not they should do this, because this is really a career rescue issue. And so I want you to wrestle with this question over the next couple of weeks, over the next couple of months, and think about what is it, what type of programming is currently in your practice that's essentially, maybe making some money, but you realize maybe the assumptions need to be changed. Maybe you haven't reviewed those processes in a while. This is one of the biggest mistakes I see a lot of concierge doctors do, and a lot of ones who are really brand new. And some of the questions that we're asking here in our leadership team at CMT, we take it from kind of a national narrative perspective. Each year after our assemblies, we come back and think, what is the message that needs to resonate across the country for this particular audience? And we take into consideration all the interviews, all the thought leaders, different opinions, different things that have been said. And actually, Jeff, you might remember a conversation we had in Atlanta a couple of years ago, and really what the message for that dialed into a conversation that had. And one of the things I want you to encourage when you talk to other doctors and you talk to your medical community and your colleagues and your patients in hospitals and leaders and administrators and patients is if concierge medicine is about super servanthood, it has nothing to apologize for. If concierge medicine is about super servanthood, it has nothing to apologize for. Regardless of whether it's $50 a month or $3,000 a month, it has absolutely nothing to apologize for. And the reason that I'm here today, and what I know about in speaking to physicians in events like this, is that you all have a healthy discontent for the status quo. That's why you're in concierge medicine. You want what could be and what should be in healthcare. And when I look at, I came home from one of these events, and this chair is for any of you psychology majors or psychologists who have expertise in that, visual aids are very important at the 10-minute mark of a person's speech, because after 10 minutes, the brain kind of says, when is this going to be over, especially since we're right up against lunch. So I want you to, if I get boring, you go back to this chair and think about what I'm about to say. I'm here to impact the world one doctor at a time. And how I want to do that is I want to encourage you and equip you and give you the tools that you need, and that you're talking to your other peers out there to encourage them to get into this as well. Because it's life-changing. You're experiencing, I mean, Dr. Jeff, you said one time, another conversation, I'd step in front of a bus for my patients. I mean, how many physicians can do that? I'm going to Canada tomorrow, and I'm going to be sharing with my family what you guys do, and they just cannot get it. They can't wrap their arms around it. They just don't understand. So I came back from one of these conferences, and I got back, and I barely had my shoes off, and my daughter was actually reading one of my books. Now, she was 7 at the time, and so it was like, I don't know if that's a good thing or a bad thing, because maybe it tells me that my books are at a 2nd grade reading level. I don't know. But she was reading one of my books right before bed, and it was about 8:30 at night, and then we said we talked about how her day was, and what went on at school the last couple of days, and then we said our prayers, and we kind of said, okay, do you have any other things you want to talk about? She's like, yeah, I kind of want to ask you a question about your book. Does everybody have one of these types of doctors? And it happened to be a patient guide for concierge medicine, a book designed to educate patients. And I said, well, no, not everybody has one of these. And what makes your doctor different is that she comes into the room and she smiles. And she comes into the room and she'll hold your hand at times. And she'll spend a lot of time asking you questions and talking with your parents. And she'll call your mom and dad and a couple days later and let us know the results of something. And so I also told her, I said, she'll also hold your hand and give you a hug and tell you that it's going to be okay when she has to give you a shot. And so what happened in that moment is really what this is all about, is that we gave her confidence, and we were able to make the world just a little bit better. And that's what concierge medicine is all about, because now that little girl is going to grow up with an expectation of what role her doctor is going to have in her life. And that's what concierge medicine is all about, and that's why I'm so passionate about it. And so where do we go in the next couple of years? We ask, as our leadership team at CMT, we ask 2 questions. What's in decline every year? What's in decline? And where are we manufacturing energy? So as we look at a lot of the trends and the polls and where healthcare, and particularly concierge medicine, as the tip of the spear, I'm here to tell you that a lot more people are looking at concierge medicine as the single most persuasive argument in healthcare. They are looking at it as the single most persuasive idea that's ever come into healthcare in the last 50 years. They're looking at you. They're not looking at you to fail like they were 10, 15 years ago. They're looking at you as this is the group that has it together. This is where healthcare is going. Mike Huckabee even said 2014, it will either be God help you medicine or concierge medicine. So as we think about what's in decline, and where are we manufacturing energy, what I mean by the manufacturing energy is you all want your patients and tell your patients, look, I need you to be healthier, I need you to eat healthier, I need you to go on a diet, I need you to exercise, etc. I need you to take these pills. But how important is it to your patients? So we asked patients, concierge patients, we asked them, we said, how important is it to you that your concierge doctor be practicing what he or she preaches? How important is it to you that they be healthier than you? 64% said, I need them to be healthier than I am. Another 27% added on to that 64% said, yeah, it's really pretty important to me. So, as we look at what's in decline, and we're going to go over some polling trends here in a few minutes, we also look at where we're manufacturing energy. I want you to think about your practice over the next few years, or the next few weeks. Back to the first question is, what if a new CEO or a new doctor came in, and they had fresh eyes? So we bring in some fresh eyes every year in from different places and at CMT, and we ask, where do you think concierge medicine is going? Where do you think it should go? And we're starting to see that there's a real dividing line in healthcare now, that evidence-based medicine is going to be used in concierge medicine. It's important. If you haven't been researching it, if you haven't connected with it, if you haven't learned about it, it's really critical. It will be a dividing line in healthcare in the near future. It is coming into concierge medicine. Genetics, like we just talked about, genetic sequencing, that's going to be very important. If there are patients who have been denied coverage, denied drugs, is there a way that we can go back and show the insurance companies data that says, look, this is a medically necessary course of treatment. They've been denied, but let's reverse the cause and show the insurance companies and these decision makers data that we can reverse some of those decisions. These are dividing lines that are going to be used in concierge medicine. So anyway, if we look at concierge medicine through fresh eyes, these are some of the things we're seeing. All right. This is really recent. This was actually within the past 4 weeks. We're receiving more inquiries from concierge medicine, from people interested in finding concierge medicine doctors and connecting with you. Now, interestingly enough, we even added a question in the last 3 weeks, are you searching for a surgeon? And this is terrible. We asked a lot of doctors, both non-concierge and concierge, how are you searching and referring a surgeon to your patients? And a lot of them said, I just refer them over because I think they're good. That's pretty scary. All right, 38% of searches are needing a surgeon also, in addition to having and looking and finding and connecting and joining a concierge doctor's office. All right, this is also something interesting. Do you ever order tests/treatments based on the patient's insurance plan or multiple coverage? So we saw that 56% said yes. All right, which source of information do you most rely on when making clinical decisions? The majority said personal experience in clinical decision tools such as UpToDate. We're going to start to see that clinical decision tools increase a lot in the next year or two. All right, does your private direct medical practice, this is a survey we did in coordination about 2 months ago with Jim Eischen. He's a direct primary care and concierge medicine attorney, and we put this question together for both audiences, for both physician audiences. And a lot are still saying, I have not formally opted out of Medicare yet. Now, a lot of, to understand direct primary care, as you know, is really becoming a purist model saying, I do not participate in Medicare and I don't participate in any insurance. Those are one of the things that we're starting to see kind of in decline. Interesting. How many additional patients do you expect that your practice will acquire in the next year? 200 plus is what they need. That's humongous. I mean, that just shows us that there's a real challenge out there. There's a real decline, not necessarily a decline, but a challenge in finding patients for concierge medicine practices. And I have been on a mission the last 10 years since CMT started to find the right way to acquire new patients for these practices. And I found it. but it ain't cheap, and it's not easy to understand, and it revolves around understanding consumer behavior and understanding what are the behavioral buying patterns of different age groups and different people and different emotional intellects. So if we're going to move the needle, that whole thing of, well, concierge medicine won't work here and it won't work there because of these reasons, or that it doesn't have a patient population to support it, we could actually move the needle and say, you know, we could probably make a concierge practice work just about anywhere if we understand the consumer buying behavioral habits. So for example, my wife's grandfather passed away, but he was very TMI, too much information for Christmas. It was like, what do you want on your Christmas? He's always like, well, I want the new Hanes underwear. It was like, they come in new colors this year. So it's like, wow, he always asks for Hanes underwear and Hanes undershirts, all right? But that age group has a consumer buying behavior that says, look, I've identified with a brand. I've identified and found something that I like, and I don't really want to change. What I like about the brand is that they're making brand enhancements. So paralleling that, if my doctor's making brand enhancements to his or her brand, I'm going to be more likely to continue to stay with that doctor. That means, is my doctor doing more cardiology testing? Is he incorporating genetics into this? Those types of things. What do you think is the greatest challenge facing membership medicine in the next 5 to 10 years? Lack of consumer awareness. I think retail healthcare is going to do a lot for concierge medicine. I think it's going to do the biggest favor towards concierge medicine and subscription models altogether, because it will do a lot of the heavy lifting from a mass consumer educational perspective. If you look at a CVS healthcare commercial, for example, and you replace the CVS Health logo with your own concierge medicine physician logo, you'll find that the messages are resonating the same: transparency, access, affordability, convenience. Those are messages that resonate with people. That's why retail healthcare is becoming so popular. All right, one of the interesting things that we found out just in the last month is there's 10 things, and I'll let you read through this in just a minute. There's 10 things that are the most pressing issues for the next 12 months for concierge physicians. And this is from non-concierge doctors and current concierge doctors. Number 1, being dropped from insurance panels because of concierge status. Number 2, potential changes in ACA. Number 3, the MACRA and MIPS. We've talked about that here. Number 4, new technology. I think there was something that came out in the news recently that it was back in May, and it was about millennials. Now, millennials is not necessarily the most attractive audience for many concierge physician practices, but a lot of millennials, a majority percentage, I can't remember what it was, so I'm not going to say it, but a majority of millennials want their doctor to prescribe them an app. So we need to get and learn what these new technologies are and how we can apply them. It's not easy. Visibility and becoming more viable on the large scale. Resourcing, number 6, financial and legal marketing issues. Number 7, identifying allies in Congress and getting the message out. Number 8, clinical quality data. Number 9, efficiency, billing, charting, managing emails, etc. Number 10, decimating the option for private medicine to our colleagues. And then I like number 11. It's not on the list, but I like number 11. I don't know. Something will pop up. So anyway, the most common types of calls, we can kind of skip that one. I like to see, because of our several publications we have, I don't just look at CMT. I don't just look at concierge medicine as the savior for American healthcare. There's going to be a lot of different variants. We see direct primary care moving in. We see retail healthcare moving in. We see micro clinics moving in. We see hospital concierge medicine programs moving in. It's going to, not one solution is going to be the solution for every demographic out there. So if we look at supply and demand, this was something we did in 2014, and I have not since updated this graphic, but I know it's more. Demand is how many patient search inquiries we get on like a monthly basis. And this pretty much was how many subscription-based medicine physicians we could find. that were verifiable. Now when you get the question of how many doctors are doing this from your local media or from your patients, there's no easy answer to this. And I know we've all read, 4,000, 2,500. I could tell you some, I've dug deep, really deep into a lot of these questions and had some physicians come and tell me well, I don't know, I just kind of made something up. And retail healthcare and urgent care clinics, the convenient care sector, suffers from the same numbers conundrum that concierge medicine does. And the reason is because there's no federal registry for what you do. It's a business model, not a licensure. So if we're trying to put our arms around how many concierge doctors there are, we've filtered a lot of what the thought leaders have said. We filtered a lot of what the investors have said, because investors are not going to put money into this segment of healthcare if they don't understand just how possibly big it is or how big it could be. We've gotten quotes from MDVIP, we've gotten quotes from Special Docs, we've gotten quotes from all of the different players and their thoughts, from Tom. What we have kind of circled around on is that there's about 12,000 total concierge physicians out there. I actually like to refer to it better as subscription-based medicine doctors. I think that the terminology in probably the next decade will probably move to what we're starting to see in the UK, because there are concierge doctors out there, but I think we'll eventually start to see it trend from concierge medicine to private medicine. That may have some impact on the ACA, it may have some impact on our legal decisions that we make in the near future, but it's going to be concierge for quite a while. And again, be proud of it, because I think that there's a lot of advantage to it. But we believe that there's a verifiable number within that 12,000 that's probably about 6,000. Meaning verifiable means I can go find you, I can look up your website, I can find your phone number, you've got an email. I had a doctor once ask me, he was a mobile pediatric doctor, how'd you find me? I was like, well, I got ways, man. So I know that there are doctors out there who are unverified that are still accepting chickens in Montana. And so there's another 6,000 that are really undocumented, unverified, so to speak. But they're practicing their own method of concierge medicine. All right, so if we look at the free market healthcare family tree, it's a lot bigger than just concierge medicine. We've got microclinics, we've got ideal medical practice environments, we've got urgent care centers, which, by the way, the reason I have most popular on there is because when you do a Google search analytic, you find that of all these free market healthcare delivery options that are available to patients, urgent care centers is trending #1 of what patients click on and choose on Google. You got retail medicine centers, you got executive health programs, both inside medical centers. Emory's got a very popular one. You've got self-employed doctors, physicians, personal physicians at corporations. You also have direct primary care clinics. So the free market healthcare delivery family tree is growing, and you're part of that. The opportunity we see is, I think this is an interesting one, the #1 reason why patients said that they left a concierge practice was because of the rude office staff. Here's a great tip. If you have your phone at the beginning of the office and patients, if they are waiting, which normally they shouldn't be, but if they are, move that phone to the back so that that patient does not have to hear your office staff returning phone calls or making any phone calls. All right. All right, so we looked at a lot of what's really the dynamics inside of a practice. Salary, we looked at salary earnings, we looked at previous patient size panels. More than 70% of concierge doctors in 2015 reported that their previous patient panel size was usually between 2,000 and 4,000 patients. Most concierge doctors reported that I need between 53 and 100 patients to have a full panel. That's huge. That means that you're doing a better job of getting the message out, because 9 years ago I did that exact same question And it was 94% of concierge doctors said, I need between 53 and 400 patients to have a full panel. So that means if we have 70%, or most concierge doctors saying, I need between 53 and 100, it means that your message is getting out there. That's huge. All right, national number of doctors, we covered that. Annual fees usually are right around $2,500. But we're starting to see some as low as $1,200, even lower in, if we look at direct primary care. Prescription compliance. In 2015, as a concierge physician, you manage a patient prescriptions more closely. Are you able to reduce the amount of medications patients use each year? If so, yes, by how much? And if I'm looking at this right, 31% said between 26 and 50% of the time. And another 30% said between 11 and 25% of the time. Most concierge docs wake up at 7 a.m. Incidentally, I polled direct primary care docs, and they are actually getting up about 2 hours earlier. Hours worked each day, 60% work between 8 and 10 hours a day now. 30% work between 10 and 12 hours a day. Average wait time, 33% of support, them and their support staff said, I have a zero wait time. That's big. All right, we keep asking questions. That number on the top of the Learning Center is actually over 400 surveys and polls now. All right, so we talked a little bit about that. There's more discounts happening out there with labs and things. Every island needs bridges, boats, and runways to be awesome as it can be. All right, what time are we running to?
We got about 5 minutes.
5 minutes. Okay. All right, so these are some hot zones. We've identified if you're talking to doctors, which you are, and you're encouraging them, and they're asking you for advice, there are certain areas that are going to work better than others, at least for right now. All right, so we've identified really which concierge medicine boom towns there could be. Alpharetta, Georgia, Little Rock, Arkansas, Phoenix, Arizona, Las Vegas, Nevada, Lafayette, New York. And then which direct primary care, no insurance, no Medicare participation, if we're looking at the purest definition of that right now, which there's a lot of definitions floating around. All right. All right. Here's one of the things I want you to remember about this is don't ever apologize for providing concierge medicine. I really think that that's so important. You're standing in your community like a tree and saying, looking people in the eye and looking your colleagues in the eye and saying, you know what? You move. I'm doing what's right for my patients. That's the message I want us to take, and that's, if we look at what's in decline, if we look at where are we manufacturing energy, and we're looking at things through fresh eyes, that's where we can take concierge medicine in the next year. All right, I'll take questions.
The question is, have we got a good list of concierge doctors, and has it been updated since the one that was started a few years ago?
The first place I go is MDVIP's website. They got the largest network of doctors. Next, I go to Concierge Choice. Next, I call my guys at Special Docs. Next, I call some of the independents that are registered through CMT. Next, I call the AAPP and I look at who's registered on their sites. And then before I make any recommendations back to the doctor, because the doctor's usually the one calling me, or the patient says, hey, I need to find somebody in this area, I'll make sure that I call those offices before I make any kind of list for them. So there's no one list that fits all. And it's unfortunate, but I think that I've seen a lot of doctors go, there was 2 doctors just in the last 2 weeks that went out of business. One went back into a hospital, and I don't remember where the other one went. So it's a fluid list, and I think that is what all of the associations and lists out there suffer from, is that we don't know on a month-to-month basis who's left and who hasn't.
What's your best guess as to how many?
We covered that. I think we're looking at about 12,000 total. That includes the 6,000 verified, if we unpack it, and then about another 6,000 unverified. Mm-hmm.
Any other questions? We have a mic up here now that works.
Michael, you are, I go back to 6-7 years ago when I was first looking into concierge medicine. A lot of the data that you published, comments that you published, are the reason why I'm sitting here. There is just no doubt about it. Because I think you give physicians the confidence to know that, hey, this is what's going on out there, I can do it too. How many physicians usually respond to surveys, number one, when you put them out there? Are they equally concierge docs versus DPC doctors? And then secondly, what would you recommend to this group going forward with the lay of the land of the AAPP and other groups out there? What do you think the focus should be here, and how can you push that along with us?
Depending upon, 2-3 years ago, the polls were going to be mixed reviews of DPC physician models and concierge models because there wasn't a real clear definition. And so in the last 2 to 3 years, we've really seen kind of this separation. And I think it's probably helpful because there is now a consumer demographic that's attracted to a lower price model. And there's a consumer that's attracted to a concierge medicine priced model. Interestingly enough, if we look back 10 years, concierge medicine's biggest argument was, well, you're just so expensive. Nobody can afford you. Well, okay, now there's a variant that lowered its price, but it's struggling to scale as well. And if it's $50 a month, now it attracts a certain demographic that's going to be very different from a consumer buying behavioral pattern perspective than the concierge medicine consumer. So how many people we got to respond to those back then was anywhere between 150 to 300-400 at times. Now we see, depending upon what the content of the poll is, we'll see anywhere from 80 to maybe 700 people respond. Just depends on how interested they are. Usually I can tell the trend, and this is not scientific by any means, because polls are, especially online polls, are not scientific, but I know who I'm sending it to and I make the page private. So these are really about identifying trends, not trying to be scientific by any means. So if we're trying to identify what's in decline, where are we leveraging each year in manufacturing energy, and where can we move ahead, and what can we learn from these trends? Because it's not just one trend that I think will help, it's a series of trends, and if we look at the series of trends that's occurring, we can see which direction, where we need to pivot and make some changes. So as far as content and looking at what is our direction, or what is this organization's or the other association's directions, our place in the marketplace is to really be an objective, more or less like a Wall Street Journal for the concierge medicine community, and to publish news and information, to connect you with people in groups like the AAPP and the ACPP and special docs and MDVIP. And that's our job, is to give them that education and security, and getting back to my daughter's comment of giving them somebody the confidence that what the decision they're about to make with their dollars is going to be the right decision. I think that if we're focused on not being apologetic anymore and telling your patients that I'm enhancing my brand by doing these certain things in my practice, I think that's what the patient population needs to hear. If I'm speaking for a patient population out there, which I see the complex cases, and I see the questions that come in, and they're just super simple, and some that say, hey, they write me a whole 4 paragraphs about, hey, I've literally had this one, I've got 6 months to live, and I can't find a doctor to help me. And so I think that we've got to look at the communication. And here's another thing, if we look at the struggle that a lot of concierge doctors have in acquiring new patients, it's not staying in your own backyard. You need to be the superstar in your own backyard. And then if we dive and unpack that even deeper of where most people coming from that are joining concierge practices, we're learning that it's usually within about 3.7 mile radius. So anybody in between that radius. You can go 5, sure. There are plenty of great free ways that really require more of a physician's and office manager's time and hustle to help you grow your practice. But I think that just staying on and evaluating as a leadership, where are you manufacturing energy, what's in decline, and taking positions on things, I think is important. We talked a little bit about that at dinner last night is, where's the press release on taking a stand on MIPS? Where's a press release taking a stand as an association? Because people want to know what you stand for. So I think taking positions on things that are maybe controversial, yeah, you might get your finger cut off, but people know what you stand for. And I think that's where concierge medicine community can move ahead.